Hi, I'm Dr. Allison Cole, sleep medicine specialist and bona fide chronic insomniac. Welcome to the Sleep is My Waking Passion podcast. Remember, knowledge is empowerment, and if applied correctly, it can help you biohack your way to a better night of sleep, just like I did.
Hello, everyone, and welcome to Season 5 of the Sleep is My Waking Passion podcast. I am your host, Dr. Allison Cole, and I am bringing back a very special guest, Dr. Funke Afolabi-Brown. This brilliant, beautiful woman has, she contacted me because she's accomplished so much, and we're going to add author to her list of things that she is doing. So she has a book coming out, and we're going to chat about why you need to immediately go and pick up this book that is going to be released on October 8th. So Funke came on the show, literally season 2, episode 4, and we talked a lot about kids and sleep and obstructive sleep apnea. She has so much more to offer than that. That's like scratching the surface of what she knows. So she's a triple aborted sleep physician. She's in the pulmonary realm. She's a pediatric specialist. And she is also the founder and CEO of RestfulSleepMD and the Restful Sleep Place. She provides comprehensive sleep services to children and young adults, addressing a wide range of sleep issues using a holistic approach that really considers physical, mental, and psychosocial factors to maximize sleep quality. She trained at UPenn, where she was an associate professor of pediatrics, and her new book is Beyond Tired, a sleep physician's guide to solving your child's sleep problems for good. Welcome, Funke! Welcome!
You are just incredible. Thank you. I think that's literally the warmest welcome I've ever had. I love it. Thank you.
Girl, you deserve it. You deserve it. I mean, we were just talking off camera about how Funke seems to manage her day. And look at this beautiful smile. She's ready to go. And this was really a labor of love. This was like fit in between patient care and speaking. And Funke's been really all over the country talking. And one of the things that I had an opportunity to take a sneak peek at the book because Funke let me. And one of the things that really resonated me with this book is it's not just about, okay, these are the tips for your kids to sleep. You're really taking a very family-centric focus. And not only that, while it's general advice, it's very easy to follow. But then at the end, you're like, hey, yeah, this might be general advice, but let me teach you how to be more prescriptive for your specific family. So it's really sort of a blueprint or a workbook, if you will, that people can go through to really, take their sleep for their family to the next level. So I love that. What I need to know from you is what motivated you to take the time to do this? You mentioned that it was sort of in you. What inspired you? Like, how did this all come together?
Yeah. Oh, gosh, so much. Many things. But I would say I think it really came from my own experience first as someone who walked the walk, right? Busy professional. For me, for Pete's sakes, I'm a pediatrician. I should have this whole sleeping kids thing figured out. Yet, no, my kids were like, absolutely not. We're not having any of that. And so I was burned out very quickly. Burned out as a mom, burned out as a physician. Yet, I would show up in clinic and be like, yeah, make sure your kids are sleeping well. Don't set boundaries? And it was just so wrong until I then figured out like what I needed to do. And then, move forward, got my training. And then now seeing in my practice what parents are coming in with, seeing parents who are exhausted, like literally driving cross-eyed to come see me, seeing the impact their child sleep issues was having on the entire family. It was heartbreaking. And I realized that. And then also now hearing, oh yeah, I talked to someone already and they said my child will outgrow it. 5 years later, this child is on meds for ADHD and behavioral issues. And then you're like, there's so many things we could have done that could have prevented this. And so this is me sort of coming all the way back to say, let's even get started and say, where are we supposed to start? Because a lot of times in medicine, we are reactive. We're not proactive, right? We wait until stuff's hit the fan and then we're scrambling and throwing everything at these kids and also at our families, right? So how do we then build a system whereby you know ahead of time, what does normal sleep even look like? What does sleep in my child look like as they evolve through various ages? When should I be scared? When should I be worried? When should I reach out and say, absolutely, I need this to be evaluated. What should I look out for? And so because a lot of times, even the symptoms that many of these kids present with, most parents are told, well, it's normal. They're just being kids, right? So I wanted to just really create that, like you said, continuum for families to get it. And it really came from, again, seeing this in my day-to-day practice, sharing that lived experience and knowing what it takes to get over to the other side where you are thriving, your child is thriving, and you're living your fullest and your best lives. And I think that really was my inspiration and my motivation.
So I had interviewed a while ago Jocelyn John. She had specifically mentioned to me the word thrive. So I am hung up on that because you are absolutely correct. We have gotten so used to living in survival mode 24/7, where you're like, okay, I've survived my day at work. Now I'm going to go survive all the stuff I need to do for the kids. And now I'm going to try to get some sleep, which probably is going to be crap, but I got to do it all over again. So you're really trying to move past the paradigm of, okay, we've got this, we're in survival mode, to thriving. So you're not the first person to tell me this, but I love the fact that there's so many people in sleep that are really emphasizing that we are so blessed to have what we have, that it's a darn shame that we're not all thriving. It's like, I almost feel like we have all this stuff, and the more stuff you have, it's almost like survival mode becomes more of a normal thing. And it's like, what? We've got to change this paradigm. I love it.
Absolutely.
So you came up with your own framework for approaching improving sleep and really addressing some of these issues. And this is the quote, create restful sleep habits framework. Can you tell our listeners a little bit about this framework?
Yeah, absolutely. So when you look online, if you literally try Googling sleep hygiene, you're going to get all kinds of stuff. It is overwhelming. It is extremely laborious. And most families are like, I can't do it. Let's just leave it. But this is what I say. The foundation is foundation for a reason. Before we start to get to high, talking about hacks and gadgets and all kinds of things, let's make sure we get the basics right. And then we can now build on that. And really, that's where that comes from. So create restful sleep habits is an acronym that really lends itself very nicely to evidence, to what really will help optimize sleep as a foundation. Of course, I know that just turning out the lights and going to bed at a certain time is not going to fix all your child's sleep issues or your sleep issues. But it is important we address those first, and then we can start to see what else is left, what else do we need to work on. So C stands for consistency, and this is really around optimizing our circadian rhythm, building that system of regularity, which our sleep thrives on. And so having a consistent sleep time, a consistent wake up time, right? Even on the weekends, you want to avoid excessively sleeping in, right? If you're sleep deprived a little, you probably can catch up on a little bit of sleep, but you really need to balance that out.
And that is not only the parents, or not only the children, we're talking about influencing the family. So this means parents modeling that consistency as well. So because a happy parent often has happier kids. I can tell you from personal experience that I found a way to turn my frown upside down. My kids are a lot better for it. So there's data that shows that if you have a more consistent sleep, that's also one of the other factors that goes into longevity on the planet. So as parents who want to be around for our kids longer, but our kids really depend on us to model that behavior. So I think that's really, 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 truly key. And the wake up time, cannot emphasize that enough, Funke. I completely agree. That is huge.
I love what you said. I think this is really about the family. It's not about you telling your child to do all these things and then you are just not really maintaining it, because they learn more from what they see us doing than what we're saying they should do. So I think that is so key, and it will help you as well as a parent. So true. And then R really stands for those routines, right? What are those things we're doing habitually? it sounds very, so basic that most people just overlook it. And I think this, especially even for parents, for most parents, their kids have a routine, right? They'll take a shower, they'll read a book, they'll get into bed, they'll kiss goodnight, and they get out of the room. So most families that I've worked with tend to have this. But I think it's really important as a parent to also have that routine as well. And I would say we now start to get into a little more of the granular detail when it comes to carving out a routine, not just a cookie cutter, but one that works for your family. If you have a child who has special needs, if you have a child who has a neurodiverse condition, this is where really fine-tuning that routine comes in, because in addition to the other things, the other, what we call zeitgebers or time givers, right, that can cue your circadian rhythm, like light and regularity. Having a routine is an external cue that can actually help with that circadian rhythm or internal clock. So your body knows, it starts to anticipate sleep once you start to run the shower, once you start to read the book. It already starts to anticipate it. So that's really helpful. And that routine also includes routine when it comes to your meal times and things like that. And then E stands for the environment, right? So really we want our environment to be cool, to be dark, noise-free. People talk about a range of bedroom temperatures. I just say, just make sure your bedroom is cooler than the rest of the house, right? And so really maintaining that nicely, making sure that the room is as dark as possible. A lot of families may have night lights and stuff all over the ceiling. Just pay attention. If it's not impacting your child's sleep, it's all good, keep going. But if you're noticing your child is waking up frequently, and you feel like the light exposure is interrupting their sleep, you might want to just check that out and work on that a little bit.
And you mentioned something in your book that I thought was really interesting, which is light wavelengths that have the least amount of influence on your circadian rhythm. And so this might be an alternative. I do, for my kids, she's talking about red wavelength in her book. And so having more of a reddish hue. What I do is I actually, my mom taught me, and I have no idea if there's any actual science to back this up. So I'm just going to state for the record, this is just a Korean mom telling her daughter what she needs to do. But she's a big believer in salt lamps. And a lot of times you can get them at Marshall's or TJ Maxx, they don't have to be expensive. And they are kind of orangey crystal looking thing. And then you have a light bulb inside and you can dim it. So it kind of has this orange hue. My kids really love the idea of a nightlight. So I was like, all right, well, salt crystals are supposed to purify the air, which is somebody on YouTube said that. So she believes it. I'm like, okay. So we use that. It's a very nice orange hue that does not interfere. So I'm just going to, source from my own personal experience that might be a wavelength of light or a nightlight that's along that hue that might be beneficial.
Absolutely. The blue lights, definitely, the light from the TV, the phones, the laptops, all of those things are more detrimental. But the red wavelength light, absolutely, I think that's a good option. Especially if you have a child who does not want to sleep in the dark, which is pretty common too. And then A stands for assign the bed for sleep and sleep only in bed. And this is important too, because our brains make associations very readily. Sometimes if your child is playing on their iPad, watching TV, doing homework in bed, that might actually be the issue. And that might be the reason why they have a hard time winding down when it's time for them to sleep. Because now these associations where you get into bed, their brain is like, well, are we supposed to sleep? Or are we supposed to do homework? Or are we supposed to be on our phones or play video games, right? So you want to strengthen that association by ensuring that when they're in their bed, it's really about sleep. And so that's really important as well.
And parents, listen up. You guys got to do the same thing. You can't be hanging out in your bed, watching movies and stuff if you can avoid it. Yeah. Basically model, and don't just be like what doctors often have done in the past, which is do as I say, not as I do. Not in this case, because those little ones, they are watching you. They really pay attention, even when you think they're not.
Absolutely. Absolutely.
And now a quick break, but don't go anywhere. We'll be right back.
Struggling with sleep? Dr. Cole is here to help. Whether you need a comprehensive sleeping coach program, suspect you have sleep apnea, or simply seek a second opinion, she's available for consultations in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 15-minute consultation today to find out which visit is right for you at AskTheSleepMD.com. and start your journey to better sleep with a trusted physician.
If you are liking this podcast, if you're finding it educational, if you are feeling more empowered to go to your doctor with any sleep issues that you might be having to address them, please, please, please lend your support. Make sure that you are liking, following, subscribing. I am available on YouTube. I'm also on Apple, Spotify, or wherever you get your favorite podcasts. The website has launched. So we have AskTheSleepMD.com to be your free educational resource. We've added many new blog posts filled with juicy information. If you would like to support the podcast, we now have a way for you to donate. This is a labor of love. I truly enjoy what I am doing. It would be inspiring and truly helpful if you wouldn't mind even so much as donating $1 to keep this podcast going, particularly if you really find this free education a good platform for you and a good resource for you. I also have affiliate links for products that I'm a proponent of, such as Quiet Mind. So please check out the website, sign up, and you will get the latest news, the latest blogs, some sleep tips, and just have a great day and keep listening. Okay, guys, sleep well.
And then T is technology. So tackle stands for tackle technology. And, we all have heard of that, right? The phones, the gadgets, the laptops, the video games, all of it. And so you really want to set a digital curfew. Usually we'll say about 30 to 60 minutes before bed. Again, this is not just for your child. This is a whole family. This is a framework that applies to every member of the family. And so really you want to avoid that because there are 3 ways usually by which technology impacts. The blue light, maybe some of that blue wavelength light might suppress your brain's melatonin and make it hard for you to fall asleep. But beyond that also is the content you're consuming. Most of the time when you're on your phone, it's either watching, funny videos or stressful videos or listening to the news or things of that sort that can be aggravating. And especially for our kids, if they consume very graphic content, they may end up having nightmares. And so those are things that you really want to set some limits on as much as possible. And then finally, I would say E, the last E is eliminate. And really, this is more of a kind of check and look at what are we taking, what are we consuming, either through, what we eat or drink, or even through what we're listening to or seeing that may disrupt your sleep. So caffeine is a common one, right? Heavy meals, sugary meals, all of those things you want to try to minimize as much as possible before bed, So those are really, I think, once you follow that, apply it both to yourself and to your child, really helps you set the right foundation when it comes to your sleep.
I love all of these because they're so comprehensive and they're going to help everyone, regardless of even if there's something else going on, like a sleep disorder. These are very helpful things that everybody really needs to try to do as much as humanly possible. Again, Funke and I would never emphasize to you, this is the only perfect way to do anything. These are all general rules because life happens and we can't always do what we got to do. Sometimes we got to pinch hit. One of the other things, actually, you've mentioned it before. So I was quiet thinking you'd mention it again, but I didn't hear you mention it. But I'm going to mention it because I thought it was such a good point on prior discussion that we've had, was the why behind the use with technology, especially when we're talking about those preteens and teens. Why is it that they're so sort of married to their phone? What's going on? What content are they consuming and why are they consuming it? You had actually alluded to in a previous discussion that we've had about, are there any psychological factors that are influencing them? Are they being bullied? Do they feel anxiety? Are they trying to alleviate some of the anxiety with some of that technology? So sort of getting to the root cause of that overuse of technology, I just think is a really remarkable point. And I know you've made it before, so I just had to throw that in there.
Thanks for that reminder. So important, especially when you set these things in place and you're getting a lot of pushback and you're having your child really struggle with following through, and you sit and have a conversation. Sometimes it may be anxiety and they're buffering, right? They don't feel comfortable sitting in the dark, waiting to fall asleep, and they're scared of their thoughts. Sometimes it is formal. They need to know what's going on. And sometimes it's pressure from school. They have homework. I don't know who set this homework deadline for 12 midnight. Like, that needs to go away.
My kids don't have that yet. That's a thing?
Not yet. It's coming. Yeah.
Great. Awesome.
So
Something to look forward to.
I
Hooray.
know it's a lot better now. But previously, homework is like, oh, it's due at Wednesday at 11:59 p.m. If we know our teenagers, they're gonna wait and they're gonna do the work till midnight, right? So some of those things could be what's contributing. Again, it's better now. I still see it. A lot of grants are due just before midnight. Like, it makes no sense. We're causing sleep deprivation when we do that. And so really getting an understanding. And sometimes it may be that, you're doing those teen years, especially with adolescents, they start to have a natural shift in their circadian rhythm. And they're just not sleepy because their body is not ready for sleep yet. And that's really because melatonin production is a little delayed. And so they don't feel sleepy. Guess what they're going to do? They want to while away time. And so that might be the reason why they're on devices. So I think regardless of what it is, whatever components or creates you're working with, if there is for some reason a pushback where you're not getting your child to be able to follow through, or you are having a hard time following through, is to go back and say, why? What could be going on here? Could there be a medical disorder? Could it be some mental health issue, some psychological issue? Could it be an environmental factor? And so really being able to address it from that lens is very important.
Are there any key sort of red flags where you go, oops, definitely get this kid over to see a sleep specialist? Sort of a Cliff Notes version of what people should be on high alert for as they go to reach out to that specialist to make that appointment with, Dr. Funke to see you.
Yeah, absolutely. And I think one of the things, I'll talk about that, but one of the things I also did, almost like a checklist at the end of the book, like we've talked about all of this, when should you know to push and say, no, this is off? So I would say first, if you're having a child who is not getting enough sleep, despite optimizing the best you can, like you've used this great framework, you've done all the things you can, but you feel like they're getting less than required. And the number of hours of sleep varies by age. So since you have your school-age child, maybe who is supposed to get 9 to 11 hours of sleep and they're constantly getting 7 hours and you're really seeing it impacting their day, that might be time to say, can we just talk about what's going on? I'm not sure. I've done everything I can. The room is dark. We've put away the devices, but this child is having a hard time. If you have a child who has a hard time maintaining sleep, right? So maybe they're waking up in the middle of the night and not just to wake up to pee and go back to bed, but they're waking up either multiple times or they're waking up for prolonged periods of time. And this is not going on for 1 week. It's going on for months, maybe like 2 or 3 months at a time. Another one would be they're waking up super early. So typical, like similar to what we see in insomnia, where your child is chronically waking up super early. You've put in all the behavioral strategies you can, but you still can't get them to stay in bed for long enough. I'm telling you, behavioral sleep issues are a type of sleep disorder. So you can have that addressed as well. And then, the sleep apnea symptoms like restless sleep, chronic mouth breathing, snoring, pauses in breathing. When you're seeing all of those things, you should just ask for help and ask that they be evaluated. And then finally, I would say, because ADHD, autism, and other neurodiverse conditions, literally almost, depending on what literature you're looking at, as high as 75 to 80% of these kids have some kind of sleep issue. So if you have a child who maybe is being evaluated for ADHD or for autism, I just will say, advocate to get their sleep evaluated, just in case. I'm not saying they may have sleep apnea. It may be a behavioral sleep problem. It may be a sleep maintenance problem. Whatever it is, just have that checked, because if they don't sleep well, their daytime manifestations are very similar to the symptoms of what a child who has ADHD has. So impulsivity, behavioral problems, maybe daytime irritability, very emotionally labile, all those things. And many times your child may be labeled as ADHD. Again, I'm not saying they don't have it, but if their sleep is short, just kind of keep that in mind.
I love that, because it just gets to the heart of what every family deals with. Is we all have those little things. And I resonate so deeply with that, because, my youngest has some attention issues and we're working through that. I have not had her sleep tested, but I did take her to a pediatric sleep specialist, and I haven't really heard some of the symptoms, so I think she's probably okay. I always, in the back of my mind, I'm like, do I need to go for that? The sleep specialist didn't think so. So I'm going to defer to you all with your expertise. I'm just the mama in this situation.
Yeah, I love that.
But did I feel weird about taking her in? No. I was like, why would I not? The risk benefit, what's the benefit? You could literally change the trajectory of your child's life by managing their sleep apnea, including their academic performance, the relationships with peers. It all has this downstream effect. So these are all like huge, huge valuable points. And the final thing I wanted to talk to you about, because I know I have limited time with my darling, and I thought this was so, so unique about your book, because I've really not heard anybody else in the sleep community talk about it, is the advice that you give for people who live in a 2-household family. For those kids that, mommy and daddy aren't together. And how do you guys come together despite being different units, and some of the challenges that occur when you have those 2 households? You guys got to definitely read that section, because that's huge. I wanted to know if you had any advice or anything you wanted to say about that portion of things, because it's a very unique perspective. It just goes to show how deeply you thought about this subject and what really I'm sure you were seeing clinically.
This is something that I've noticed. When I provide recommendations in my practice, and they come back and either the recommendations were not followed through, or there's gaps where it says, oh, well, every other week, everything is okay. And then, the week when the child is at the other parent's house, everything just falls through the cracks, right? Like nothing, everything goes, no routines. And so then it makes it such that this child is almost like flip-flopping emotionally, physically, mentally, and is not getting sufficient sleep. So that was what motivated me to dedicate a whole chapter to that. Like, okay, it's fine, right? This is where we are. The fact that this child is living in 2 separate households is very common. And we really need to pay attention to what's the emotional toll this is having on this child, making sure that from that standpoint, they're okay. So whether there's family therapy, whether there's individual therapy, whatever it is, because these kids will carry a lot of blame as they're going to sleep. And sometimes that's the reason why they're struggling with sleep. So that's one piece that I always talk about. And I talked about that a little bit in the book. And then the other piece is the environmental factors, right? In this house, there's no blackout curtains. In the other house, there's blackout curtains. In this house, they're allowed to bring their device into the room. In the other house, dad is super strict, right? And I shared some stories there too. And so that change, even within the environment, also can contribute. So the environmental factors. And then just the schedule. Maybe one parent is working shifts, the other parent has a regular 9-to-5 job. And so bedtime is just all over the place. Because when I'm with parent A, I can go to bed at 8 p.m. When I'm with parent B, well, we don't have dinner till 8 p.m. So we're not going to bed till 10 p.m. So all those things play a role. And so we delve into, and it's very pretty detailed. I think one thing I would say to start, regardless of what the issue is, get on the same page. Get on the same page on your co-parenting. Get on the same page for the sake of this child. Find a way to make it work. Because, people talk about, like, many times our kids are impacted by whatever choices we make. So just make that a priority, because when the child is well rested, emotionally they're better, they're more stable, they're able to be more resilient, they're able to thrive in school. And this is not about pointing fingers, it's your fault or my fault. Let's just say, how do we move forward together? And sometimes even in my practice, I'd say, okay, you know what? Have mom call me, have dad call me, or see if you guys can both show up. And that's one of the things I do. I offer virtual visits as well, because this way I can talk to both parents and say, hi, let's come up with a game plan. When you're in parent A's house, what does the schedule look like? When you're in parent B's house, is there anybody else? Is there a grandparent? Is there a nanny? Is there a babysitter that needs to be in on this plan, so that at the end of the day, we have success?
And how you're describing this makes it sound so logical and so easy, and it is not. Guys, you are hearing from a master who's able to take people who otherwise are not together for a reason. They may not have gotten along, just saying.
Yeah.
And you figure out where the commonalities are, which is the link is most parents really want the absolute best for their kids. So if you can get them to agree on that much, especially if the child is struggling with sleep, it's such a win. And the fact that you have created a system where you can really help people get to that next level is so, so huge. So Funke, I just want to thank you dearly for your time, for your expertise. I am so excited for you to start this next chapter of your career as an author on top of everything that you're doing. If you want to find her information, her social media handles, her website, all of that's going to be listed on my YouTube page. And, you can find all that information if you're listening to the podcast on Apple, Spotify, etc. And if you aren't, please sign up to become a regular listener, like, share, rate, all of that good stuff. I'd really appreciate it. Any final words that you'd like to leave our listeners with?
I think I would say, like you said, especially when it comes to sleeping our kids, think about what will move the needle forward. Sometimes we're caught up with what we think we want, but many times we don't take into consideration as much as we should what our kids really need. So if that's a focus, that will end up doing it becomes that investment that has a massive return. Because when you invest in helping your child sleep better, then you're going to rest better, hopefully. Or now you're going to have time to say, okay, now what's left? What do I need to do to focus on for my own rest, for my own well-being? And so when kids sleep well, parents thrive. So you investing in your child's sleep health, at the end of the day, is really investing in your own health. And I want to say thank you so much. You're such an incredible friend and such a great support. And I love the work you do on this platform. You are changing lives, and I know it's really a labor of love, but I want to say that your work is truly appreciated.
Oh, thank you, honey. Thank you. Thank you so much for joining me and for giving me your time today, busy lady.
Thanks for having me.
Disclaimer. The statements made on this podcast have not been evaluated by the U.S. Food or Drug Administration. They are not intended to diagnose, treat, cure, or prevent disease. The information provided by this podcast should not be used as individual medical advice. While I am a practicing sleep provider, I am not your sleep provider. You should always consult with your personal healthcare provider for individual recommendations and treatment.